Hello, we're Hannah and Leanne from The Contented Gut, and in this short video, we're going to explain how gut-directed hypnotherapy can help your IBS symptoms and how you can access gut-directed hypnotherapy courses with us. We're both registered dietitians who work part-time in the NHS. Hannah is a gastroenterology specialist dietitian in Bath, and Leanne is an adult allergy specialist dietitian in Oxford. And we both also have private practices. In 2021, we both trained with the British Society of Clinical and Academic Hypnosis so that we could offer hypnotherapy to our clients with irritable bowel syndrome, or for those with ongoing symptoms of celiac disease that haven't improved with diet, or inflammatory bowel disease that haven't improved with medications and dietary changes.
So first of all, just to clarify what we mean by irritable bowel syndrome, or IBS. The National Institute for Health and Care Excellence, known as NICE, provides this definition. Abdominal pain or discomfort which is relieved by defecation or passing a stool, or is associated with altered bowel frequency or stool form. And alongside this broad range of symptoms, two of the following: altered stool passage, which might be straining or urgency or incomplete evacuation, or abdominal bloating or distension, tension or hardness, or symptoms which are made worse by eating, or passage of mucus. And other symptoms may include fatigue, nausea, backache, or bladder symptoms. So these symptoms overlap with many other conditions, so it's important to discuss your symptoms with your GP to decide whether investigations should be carried out to rule out other causes before embarking on dietary changes or hypnotherapy. There are lots of reasons why someone may have IBS symptoms, so there are many strategies that can have an impact, and as dietitians we take all these into consideration when we're helping our clients with chronic gut symptoms and deciding how we can help. I'm just going to take you through the various contributing factors. First of all, our genetics may determine whether we get gut symptoms, which of course is out of our control. But research comparing thousands of people with and without IBS found 6 genetic differences were more common in people with IBS than in controls. Interestingly, most of the altered genes were found to have more clear-cut roles in the brain and possibly the nerves which supply the gut, rather than the gut itself. So this suggests that focusing management just on gut function may not be enough. We have an estimated 100 trillion microorganisms in the gut, and we now know that a diverse range of microbes are needed for a healthy gut and general good health, and people with IBS have been shown to have less diversity than healthy controls. So an altered gut microbiome, which might result from taking antibiotics, or having an infection, or a limited or poor quality diet, can have a big impact on gut health, leading to changes in the way the gut functions, such as the movement or motility, how sensitive it is, how permeable the gut lining is, and as they produce important signaling molecules to the brain, an altered gut microbiome can also have an impact on our mood and behaviour. Then we have low-grade inflammation and immune activation. Increased numbers of inflammatory cells have been found in the samples of the gut linings of people with IBS. This may have resulted from a viral or bacterial infection, for example, and the chemical messengers produced as a result can then affect the nerves and the immune function of the gut. Hormones are another factor. Many women find that gut symptoms change with fluctuating hormone levels during their menstrual cycle, often with a slower gut transit causing constipation just before a period and looser stools during a period. Or during pregnancy, constipation can often be an issue due to the changing hormones and also the size of the baby. And also during perimenopause, when hormone levels are fluctuating. So it's important to take hormones into account when trying to work out what is triggering your symptoms, and keeping a diary could help you to keep track of this. And then, of course, diet. As dietitians, we regularly discuss dietary changes to help with gut symptoms, as the food we ingest provides food for the gut microbiome as well as ourselves. And the type of diet we follow will therefore affect the balance of the gut microbiome, which can have beneficial or detrimental effects depending on the diet and the individual. And then we come to chronic stress and anxiety. Many of us will be aware of butterflies in our stomach or changes in bowel function when we're nervous. As you may know, stress stimulates the sympathetic nervous system, which increases heart rate and blood flow to the muscles and decreases blood flow to the skin and the gut. This is known as the fight or flight response. So stress does affect gut function, and it also influences the balance and the growth of the gut microbiome. Under chronic stress, or perhaps as a result of past trauma, these stress signals can continue to be sent via the stress hormones, which then have a long-term effect on the body. So it's important to firstly recognise that stress is a factor and where it's coming from, and then if possible to take steps to reduce the effects of stress on the body. So this might be learning to say no to extra work, for example, or to make time to relax, not feel guilty for taking a rest or a holiday, or incorporating relaxing pastimes like yoga or hobbies, mindfulness or meditation. Of course, it's not always possible to change whatever is causing the stress, but recognising that it could be contributing to your symptoms and working on a way to change how you respond to the stress can make a big difference. Lastly, we have this gut hypersensitivity and altered gut-brain microbiome axis. Research has shown that people with IBS have a lower threshold for pain sensations than people without IBS, so they notice sensations at a lower level. The gut-brain microbiome axis refers to the network of connections that allows communication between the gut and the brain via signals sent by the microbiome and involving the vagus nerve. Hypnosis or hypnotherapy can change the way the brain responds to the signals from the gut, which we'll explain a bit more about in a moment. So this link with the brain and the gut is now so well recognised in the research that IBS is now referred to as a disorder of gut-brain interaction, or DGBI. This is recognising that there is a miscommunication due to altered signalling between the autonomic nervous system, so that includes the sympathetic nervous system, which, as I said, is involved in the fight or flight response, and also the parasympathetic nervous system, which calms down that stress response. Nerves in the gut itself, which is called the enteric nervous system, the central autonomic regions of the brain which process the signals, and the gut microbiome, which produce signalling molecules to provide communication between the gut and the brain. And as I said earlier, this results in changes in the movement of the gut, the sensitivity of the gut, the immune function, and also our mood. So in practice, what does this actually mean? Well, there's a structure in the brain called the amygdala, which is part of the limbic system, and this is part of the brain which is involved in our behavioural and emotional responses. It detects fear and threat and initiates and maintains the fight or flight response. And that response can become an automatic one because it bypasses conscious thought. So maybe there's been a stressful or traumatic event in the past that caused the brain to send out these signals to the gut. Or perhaps there's been an infection which alters the gut microbiome, causing the signals to become amplified, triggering hypersensitivity. So you may start thinking, uh-oh, what's wrong? Is this serious? And this leads to emotions such as anxiety or anger or frustration or low mood, which in turn leads to hypervigilance. The amygdala keeps sending stress signals and you're consciously thinking, what's wrong? And looking for trouble, which perpetuates this cycle. So this is the disordered gut-brain axis, where you notice more and you change your behaviour to accommodate or manage the symptoms. So that might be by avoiding certain foods or limiting social events or travel.
So what is hypnosis? So there's actually no set definition, but we like the one that's written here. So we've got a waking state of awareness or consciousness in which a person's attention is detached from his or her immediate environment and is absorbed by inner experiences such as feelings, cognition, and imagery. So it's probably a state that we can all identify with. Say when we're absorbed in watching a film or reading a book, maybe you're having a daydream and you might not hear somebody calling your name if you're deeply absorbed. Because what you're doing in these situations is focusing your attention on something very specific. And so you're absorbed in this, and therefore you're less aware of your external environment. So hypnosis is actually a natural state that we all go in and out of on a daily basis, some more than others. Now, hypnotherapy uses that ability you already have to focus your attention, and the hypnotherapist is guiding your attention by using imagery. And then gut-directed hypnotherapy is just the use of very specific imagery that relates to gut function. Now, it might not be obvious to the listener, not in a hypnotic state, that it relates to gut function, and that's because the language is often metaphorical. For example, instead of saying, stop rushing to the toilet, as a suggestion, and stop having diarrhea, we might talk about slowing down a river and turning it into a calm, babbling brook. And we're going to talk a bit more on the next slide about why we use metaphor. So we're going to talk about how hypnosis works. Well, one way to explain it is to think of your brain like a computer. So each side of your brain, which we call hemispheres, are programmed differently. The left side, or the left hemisphere, is programmed to work with logical, rational, and critical thinking, but it doesn't do emotions very well. Whereas the right side of your brain, your right hemisphere, is good with emotions, feelings, intuition, imagery. And the right side has more connections with your body's control centers. So things like your heart rate, your breathing, your appetite, and your bowels. So really, we're saying that hypnosis helps you to log in to the right brain function and therefore better control body functions. Another way of thinking about this is to think of your brain signals being on autopilot and automatically following a set path, a bit like if you walked across a field in the same way every day, and over time you get that same path, as you can see there. Hypnosis and hypnotherapy help to change the direction of that path, so you no longer notice the symptoms. If you Google image the word hypnosis, this is a flavor of what you get, which is not always very helpful. So we want to reassure you that hypnosis is not. It's not about controlling another person's actions or words or thoughts. You're actually completely in control of what's going on. And in fact, the participants report after hypnotherapy, they feel more in control of their symptoms. All we're doing as hypnotherapists is guiding you with suggesting imagery and getting you to use all of your senses. It's not a truth serum or lie detector. In our sessions, there's no requirement for anyone to talk. So it's not a counselling session. We're not delving into your past. We're not counsellors or psychotherapists. So if you've had a traumatic event that's impacting on you now, then what we'd recommend is that you see a counsellor or psychotherapist first. It's not magic. We don't talk in funny voices or wear capes. Hypnosis does not make the impossible possible. We're not offering suggestions to try and make something true that isn't. It tends to be that if someone doesn't agree with a suggestion, they just simply disregard it. And you'll not forget everything that's happened. Time distortion, though, is likely. Sometimes people are surprised at how quickly time has passed, but you'll remember as much of it as you do with any conversation. And we definitely don't have the ability to make you cluck like a chicken or bark like a dog, because that's stage hypnosis, and this is really different. And hypnosis is more than just placebo. There's lots of research using brain scans which show what's happening in the brain under hypnosis. So briefly, the hypnotherapy process involves an induction. This is the stage to encourage eye closure, whole body relaxation using calming imagery. And then deepening to encourage a deeper relaxed state. And we may use metaphors such as a staircase or a floating cloud. And we'll use all 5 senses. So for example, your visual senses, your auditory, so hearing something, kinesthetic, so touch of something, olfactory, which is your smell, gustatory, which is your taste. And then we use therapeutic suggestions depending on the symptoms. And then we end by returning to the conscious and alert state. So there's now 40 years worth of research showing that gut-directed hypnotherapy is an effective tool for managing and improving IBS symptoms. This and the next slide shows some of the key published papers, and we won't go through each paper in detail here, but we have provided some links on our website that you can access some of the papers if you'd like to do some further reading, and you can find that on the contentedgut.com. And just so you know, where it says IBS SSS, that stands for IBS Symptom Severity Scale, which is a standardized scale used in research for measuring change in overall symptoms. And more than a 50-point improvement is considered to be clinically significant. Based on this evidence, NICE, which is the National Institute of Clinical Excellence, and the British Society of Gastroenterology, recommend gut-directed hypnotherapy as an effective method for helping people with IBS whose symptoms have not improved after a year. And on average, the success rate for gut-directed hypnotherapy is around 70%. It can work when given individually or in groups or online. And it's been shown to be as effective as a low FODMAP diet. So gut-directed hypnotherapy, in summary, has shown that it can change stomach acid secretion, increase stomach emptying, alter transit time, and reduce the hypersensitivity of the gut. It can influence processing of pain signals. It can improve symptoms of IBS, including abdominal pain, bloating, and bowel function. It can improve general well-being, quality of life, anxiety, and depression.
As gut-directed hypnotherapy is not widely available in the NHS, despite the evidence, we set up the Contented Gut to offer online gut-directed hypnotherapy courses in small groups of up to 6 people at a time. And by offering it this way, we hope that it will be more affordable and accessible to as many people as possible. The course involves 8 sessions over 3 months, usually the first 5 weekly and the last 3 fortnightly. We use validated scripts, and you'll be sent a recording to practice with between sessions. There's no requirement to talk to anyone else in the group or discuss symptoms if you don't want to. You can just sit and listen. But often participants have found that the group setting to be really supportive, and it's been really helpful for them to see that other people are experiencing the same symptoms. We do evening and daytime sessions, and you can find details of the course dates and prices on the website. If you find that you can't attend some sessions during the course due to other commitments, you can swap to another session as long as there's room. And if you're due to go away on holiday or for work during the course, you can still join from wherever you are, as long as you have somewhere suitable to go and a good Wi-Fi connection. Past participants report that having dedicated sessions booked into their diary helps them to maintain momentum and provide support. And if you're not sure whether hypnotherapy is for you, we've included a link to recordings on the British Society of Clinical and Academic Hypnosis website, which other therapists have recorded that you can access for free so that you can get a sense of what it feels like. So what would you need to take part? Well, you need to have a diagnosis of IBS or have been advised by your healthcare professional that gut-directed hypnotherapy could be helpful for your symptoms. You'll need a laptop or phone or tablet that you can position so that we can see you from the waist upwards and have a good Wi-Fi connection and be able to hear us clearly. You need to be somewhere quiet and comfortable. Your environment doesn't have to be silent. And some people have managed to go to a quiet office at work, for example, if they can't be at home. It's a good idea to be somewhere where you can have support for your head, though, so that you can fully relax. You want to be where you'll not be disturbed by people or pets. And you do need to be prepared to practice and put the time in. It's not a quick fix. Basically, the more you put in, the more you'll get out of it. And as I mentioned, you'll be sent a recording to practice with between sessions. Now, just to note that this course isn't suitable if you have dementia or if you have suffered with psychosis or severe depression either now or in the past. If you're currently receiving care from a psychiatrist or psychologist for mental health issues, including an eating disorder, please contact us first to discuss whether the course is suitable for you. So if you're interested in taking part, you can complete the contact form on the website, or you can ask your doctor or dietitian to refer you, or you can email us directly. If you're keen to try gut-directed hypnotherapy but find that the times are not suitable, or you would like to try it but you're not keen on taking part in a group though, please contact us and we can discuss whether individual sessions would be possible at other times. Thank you for watching, have a relaxing day and hope to see you soon.